Hello, my name is Ashley Henderson. I'm one of a group of faculty that decided we wanted to take some time doing some faculty development, and I'd like to take a few minutes to talk about teaching on the wards. As you all know, we've signed up as academicians to help teach on the wards, and that's part of what we do. But we decided to do a needs assessment to see what was really needed by our trainees. So there was a group of us that did this survey and did it in medical students, residents, and fellows. And from our survey, we learned that there were 12 main topics that we wanted to address, that we wanted to see how they wanted to prioritize. And teaching on the wards was number 2. So this is something that's really important and something that we feel is valuable for all of us. And hopefully I'm going to take the next few minutes, less than 10, to convince you that this is something that you can prioritize without making it problematic or challenging or overly time consuming for anyone. And so with this, let's talk about what we can do. I provide some resources here. I will fully confess that Eric Zweimer from the Academy of Educators, he's currently the president, has also done a video on teaching on the wards. He did it during the pandemic and discusses during the pandemic, but really has some nice tips about teaching on the wards. So I provided that here. There's also resources through AIM, or the Alliance of Academic Internal Medicine, and through the JAMA Rational Clinical Exam series that uses specific cases. But I'm going to focus another way of approaching teaching on the wards through the resource listed here by Smith. So this is Eric's slide, Eric Zweimer. He provided 3 tips for inpatient education, and I just want to mention them here, but again, you can get more details from his video. The 3 things that he listed was to be sure and individualize teaching and provide feedback, because that really makes everyone feel important on the team. Deliberately teach the physical exam, which I think is something we often forget as attendings, that's something that we have taken for granted all these years and should take the time to do. And to give each trainee some responsibility that makes them feel part of the team, but also helps them learn by really having ownership and responsibility. With that, I'd like to switch to trying a little bit different mode. This is different tips of how to teach on the wards, and it uses the acronym TEACH. So I thought that was kind of convenient. So I'm going to go through each individually very quickly. You'll see that this won't take long. So first, let's talk about taking advantage of opportunities, or T for teaching. Keep in mind that those opportunities are limitless on the wards, and don't assume that anyone knows anything. If you focus on what's at hand and what's in front of you, they'll remember it, and they're appreciative of that. So keep your topics really centered. It doesn't have to be long. It doesn't have to be detailed. And in fact, on one of the surveys, the resident specifically stated it doesn't have to be a 2-hour-long didactic that's done after the wards. It can be done right there during the rounds and can be specific to what you've just seen or what you've done, and they'll remember it. In addition, when you do those times, point them out, signpost them, because sometimes they forget that that's actually teaching happening. And there are many times, particularly when I'm thinking about a differential diagnosis or what I think is going on in the rounds, that I just think out loud. And they appreciate those moments too, to know that we don't always know exactly what's happening, but we're thinking through the process. So that's T. E is empowering the learners. And this is also what was suggested in Dr. Zweimer's video. Really give those learners the opportunity to be individuals, but also to take autonomy and have ownership. Let them make decisions. This is really important for them feeling like a doctor, but also making them part of the team. And this is all the way down to the medical student level. Give them specific tasks, assign goals, and allow them to speak, because they often have subtle things that bring up that you may not have known about. And by giving them the autonomy, particularly with medical decision-making, they really feel important and a valued member of the team and will learn from it. A is assuming the role of the leader. Remember that you are in charge. You are the attending and you set the example. If you make some comment about a patient away from the patient's room, they remember that. And that's not something we want to set as an example. So model good behavior and you will gain the respect in doing so. Being positive and being excited about being there, they see that, they feel that, they're happy to be there too because you're excited to be there. And then important as a leader, you need to recognize the deficiencies of the group and how you can help. It could be at any level, but everyone can contribute, and it's your job to find ways that they can contribute. Next is creating the learning environment. That's also a part of being the leader. Make that environment effective, quick, and use the time management skills to get through rounds, but still provide teaching. There's a well-known system called the 1-minute preceptor, but Deb Bynum with Donald Bordley actually created something called a 30-second preceptor. And it talks about using the time that you have. In 30 seconds, you can really ask questions, and you can ask about what is happening with the patient, why they think that is happening, and when they see it, what does it make them think of? And so using the what, why, and when really helps them think about what's happening with the patient. So you can use the Socratic method or use the pimping method to really ask questions, because it probes what they know, but also encourages them to think more about it. And I really like this method because I think it really can make them think about what they're doing rather than just being told what's being done. Also, remember to give feedback to them based on what they did. It doesn't have to be judgmental, it doesn't have to be critical. We're all learning together. So I really think creating a learning environment is really important and can be very well received. H is for habituating the practice of teaching. Make it a habit, make it a priority, make it something you're going to do every time you're on rounds. It doesn't have to be long, but it can be deliberate. And like we mentioned before, can be enthusiastic. And again, signpost that you're teaching. As always, highlight the key points, and you can take advantage of what you've just seen with the patient to do so. So those are the 5 letters of TEACH: taking advantage of opportunities, empowering learners, assuming the role of leader, creating a teaching environment, and habituating the practice of teaching. You're already doing it, so now it's just a matter of making sure that you're being purposeful about it, setting goals, and importantly, really empowering the learner to know that they can be autonomous and they can think about it too. And that's my 5 statements there with TEACH. That's all I had to say for today about teaching on the wards. There are many other things you can do, but I hope this short video allows you to think about that. Thanks very much for your time.